discuss about the dengue virus, its classification and the laboratory diagnosis, right? How we can done the laboratory diagnosis and how can we detect and how can we release the report whether the patient is positive for dengue and negative for dengue, right? So let's start. So what are dengue viruses? So students, dengue virus is the most common arbovirus found in India. Now what is arbovirus? Arbovirus is the main classification, right? Every microorganism has some classification, right? So we have a main classification under which we have further sub-classification in any kind of microorganism, whether it is bacteria, whether it is parasite or whether it is virus, right? If I'm talking about the bacteria, so we have a classification like gram-positive bacteria or gram-negative bacteria. Then we have a family such as Enterobacteriaceae. So under the gram-negative bacteria, under the family Enterobacteriaceae, we have a bacteria Escherichia coli. Similarly, here in virus also, we have a classification arboviruses, and in arboviruses we have a virus which is known as dengue virus, right? So in India, it is a most common virus, right? Most of the students are suffering from the dengue in every season, every year in rainy season, right? So it has 4 serotypes. So our dengue virus has 4 serotypes, DEN1 to DEN4, right students? So it has 4 serotypes. What is the meaning of DN? Dengue. So dengue 1, dengue 2, dengue 3 and dengue 4. So DEN1 to DEN4, it has in total 4 serotypes. Now recently, fifth serotype, which is known as DEN1, dengue serotype 5, was discovered in 2013 from Bangkok, right students? So now in total we have 5 serotypes of dengue. Already we have 4, and now recently in 2013 the fifth serotype is also discovered from the area Bangkok, right students? Let's move forward. So if I'm talking about the vector, so what is vector students? So dengue is virus. First of all, let's clear. Dengue is virus under the family arboviruses, right? Dengue is the virus under the family arboviruses, and it causes the disease which is known as dengue fever. A patient is suffering from the high fever along with various other symptoms also, such as vomiting, nausea, joints pain, headache, body pain, right? We will also discuss about the symptoms also. So how this disease is occurring, how this disease is transmitted from one person to another, or from the vector to the human beings, right? Suppose I am suffering from the dengue, so how this dengue occurs inside my body, how does it takes place, right? How the virus enters inside my body. So there are various routes of transmission, right? Suppose if I'm talking about the parasite for a minute, right? Suppose I am suffering from the parasitic disease. So what is the most common route of transmission? So in case of parasites, the most common route of transmission is fecal-oral route. What is the meaning of fecal-oral route? That I consume something, I eat something, or I drink something which is already contaminated with the parasite, or my hands are contaminated with the parasites. I do not wash my hands and I do not properly cook my food or do not wash my food and consume it, right? So through the fecal-oral route, when I eat contaminated food or with the contaminated hands, parasite enter inside my body. Similarly, vector has a function. It is also a mode of transmission, right? Vector is some insect, right? Vector, there is an insect which is a mosquito, right? In case of dengue, we have a mosquito as a vector, which plays a very important role in transmission of the disease from person to person and from mosquito to the person, right? So which mosquito? So here you can see Aedes aegypti, right? Aedes aegypti, and second one is Aedes albopictus, right? So we have two mosquitoes, Aedes aegypti and Aedes albopictus. These two are the principal vectors, right? These are the vectors which are help in the transmission of dengue from one person to another person, or from mosquito to the human beings, right? They bite during the daytime, usually during the daytime, okay? So we have the two mosquitoes. So they play a role as a vector, which are known as Aedes aegypti and followed by Aedes albopictus. And Aedes aegypti is the principal vector, followed by the Aedes albopictus, right? Now, transmission cycle. What is the transmission cycle, students? So here man and Aedes are the principal reservoirs, right? Man and Aedes are the principal reservoir, and transmission cycle does not involve other animal. So in case of the dengue virus, if I'm talking about who are responsible for the transmission and who are involved in the life cycle or in the transmission cycle, only man and the mosquito, which is a Aedes mosquito, is the principal reservoir. They are only involved in the life cycle or in the transmission cycle, right? So in the transmission cycle, no other animal is involved, only a mosquito and a man, right, students? So this is about the vector and transmission cycle of the dengue virus. Let's move forward. So let's talk about the clinical classification. So what is the classification of dengue virus? So there is a traditional classification which is given by the WHO or World Health Organization in 1997, right, which is followed till now. So there is a traditional WHO classification, and according to this classification, it divides dengue virus into 3 clinical stages, right, students? So WHO has given the classification. This is the traditional classification which is also followed now. And according to this classification, we have 3 clinical stages of the dengue virus. First one is normal dengue virus, and second one is dengue hemorrhagic fever, right? In which a patient is also suffering from the internal bleeding, right? Or bleeding from some organs. So dengue hemorrhagic fever means the patient is suffering from the internal bleeding. Then we have dengue shock syndrome, right? So if dengue is not treated on time, right, so the patient will also suffer from the shock syndrome. So we have the 3 clinical classifications. First one is dengue fever, then we have the dengue hemorrhagic fever, and then we have a dengue shock syndrome, right, students? So this is about the clinical classifications. Now, just give me a minute. So I'm turn on the chat option so you can tell if audio and video is visible to you, right? You can confirm, am I audible to you and the screen is visible to you, right? And if you have any query till now, you can ask. The screen is visible to you, students? Okay, thank you. Okay, so we will continue with the lecture again. Just give me a minute, I'm sharing the screen. Okay, I'm sharing my screen. So this is our clinical classification, and we have 3 clinical classifications, okay, as we have already discussed. Let's move forward. So we will discuss one by one every clinical classification. So first one is dengue fever, right? So what is dengue fever? So it is characterized by abrupt onset of high fever, which is also known as biphasic fever or saddleback plaque fever, right, students? If I'm asking you in your viva or in your question paper, give me an example of a biphasic fever, right? Give me one example of biphasic fever or saddle plaque fever, right? So now you can answer able, yes, biphasic fever is a kind of fever. Example, dengue, right? And you can explain about the dengue fever. Or I can also ask, dengue fever is what, in case of dengue virus, what kind of fever is shown by the patient? So you can easily know the terms biphasic and saddleback, right, students? So in case of dengue, the fever is characterized by abrupt onset of high fever. Suddenly, patient experience high fever, right? Abrupt onset. Then what patient observes? Maculopapular rashes over the chest and the upper limbs. So in the chest area, in the upper limbs area, what are the upper limbs? In the arms of the patients, in the hands of the patients, right? So in the upper limbs and in the chest area, the patient is you will observe your patient with maculopapular rashes. There are some rashes is present on the skin of the patient in the upper limbs and in the chest area, right? Then the patient is also suffering from the several frontal headache. The headache which is present in the frontal area, in this area only, right? In the forehead. Okay. So several frontal headache is also experienced by the patient if he or she is suffering from the dengue fever, right? Then we have muscle and joint pains. So I think you all are aware these symptoms are very common as dengue fever is very common in India, right students? And various patients every year in the rainy season is suffering from the dengue. So we have also listened in our neighbors or in the patients, those who are working in the hospitals, right? So I think you all are aware about the symptoms that muscle pains, joint pain is present in case of dengue, nausea is present, frontal headache is present, right? Then lymphadenopathy, retroorbital pain means pain in the eyes, right? And loss of appetite, nausea and vomiting. They do not want to eat. If they eat, they feel a pain in their GIT area, gastrointestinal area, right? Then they feel like nausea. They feel like they have to vomit, but it doesn't happen, right? So they feel nausea or they feel vomiting also. If they eat something, suddenly they vomit, right? So these are the common symptoms which occurs in the first classification, which is known as dengue fever, right? So dengue fever is characterized by these symptoms: abrupt onset of high fever, then the musculopapular rashes, frontal headache in this area only, muscle and joint pain, orbital pain, lymphadenopathy, and the loss of appetite, right? Let's move forward. So, just give me a minute. Yeah. So second one is dengue hemorrhagic fever. Okay, students. So now dengue hemorrhagic fever is characterized by high grade continuous fever. In dengue fever, there is an abrupt onset of high fever. Suddenly, patient has a high fever, then it goes down. Then again, patient is suffering from high fever, right? It is in a biphasic fever. In a meantime, patient is feel or suffering from the high fever, then it slows down. Then again, he is suffering from the high fever. But here in the dengue hemorrhagic fever, he is suffering from the continuous fever, right? He experienced the continuous high fever, which does not comes down. Then the hepatomegaly, the liver of the patient is also start affecting, right students? Dengue fever can also affect the organs, right? It can also cause the internal bleeding if it does not treat on time, right? So treatment on time in case of dengue is very important as it will be very dangerous for the patient, right? So hepatomegaly, it can also start affecting the liver of the patient. Then the thrombocytopenia, it can also start affecting the platelet count of the patient and the raised hematocrit. Hematocrit value will be raised if you go through the CBC report of the patient who is suffering from the dengue, right students? So dengue hemorrhagic fever is characterized by these conditions that patient will suffer a patient will experience high grade continuous fever. The fever is in the continuation, right? And a high fever. But in case of the dengue fever, the patient is experienced once in high fever, then it slows down, then again the high fever. But here the continuous fever, liver will be affected, platelet will be affected, and the hematocrit value will be increased, right? Now, then we have the third classification, which is known as dengue shock syndrome. Right, students? So here, all the criteria of dengue hemorrhagic fever are present, and in addition, manifestations of shock are present, such as, so all the criteria of dengue hemorrhagic fever is also present in the dengue shock syndrome. What does it mean? That all these characteristics which are present in dengue hemorrhagic fever, such as hepatomegaly, high grade continuous fever, thrombocytopenia, and raised hematocrit, these conditions are also present in dengue shock syndrome, and in addition to that, some other conditions are also present, such as rapid and weak pulse, right? Pulse rate will be decreasing, weak pulse, narrow pulse pressure or hypotension. Patient will start experiencing hypotension, right? And pulse rate will also get affected or fluctuating. Then presence of cold and clammy skin. So in case of dengue shock syndrome, as it is a third stage, right? After the dengue fever or dengue hemorrhagic fever, now patient is in the stage of dengue shock syndrome, right? So it is the third stage. It is a very severe stage of the dengue. So now here the skin of the patient also start feeling cold and clammy, right? And the restlessness. A weakness is experienced by the patient. A restlessness is experienced by the patient, right, students? So these are the conditions which are present in case of dengue shock syndrome. All the criteria, all the characteristics which are present in the hemorrhagic fever, that is hepatomegaly, thrombocytopenia, and all other things, along with rapid and pulse weak, narrow pulse pressure, hypotension, cold and clammy skin, and restlessness. So these are the conditions which are present in the third stage of dengue, which is a severe form of dengue, which is known as dengue shock syndrome, right? Let's move forward. Let's discuss about the classification of dengue virus, which is given by the WHO in 2009, right? So 2009 WHO classification of dengue virus. Just give me a minute. So this is the most recently described classification by WHO, which grades dengue into stages based on the severity of infection, right? So WHO basically classify the dengue virus in two main stages, right? Based on the severity, right? Which stage has more severity, right, students? So first one is dengue with or without warning signs. It means the severity is less in this condition, the first one, right? So here dengue is less severe. So dengue is present in the patient, but sometimes with warning signs and sometimes without warning signs. Means sometimes patient showing symptoms and sometimes patient does not showing symptoms. So it is not that severe. But the second classification is known as severe dengue. That this is the severe condition. Patients showing the signs also, and it affects their organ system also, right, students? So WHO classify the dengue virus into two classification according to their severity of the infection, right? First one is dengue with or without warning signs, and second one is severe dengue. So we will also discuss about both these classification, but now I will share a feedback form link with you, right? So if till now you have any doubt, you can ask, and I'm going to share a link with you all, right? Just give me a minute. I'm going to share a link with you. Students, please check it. I've already shared the Google form link with you all, and you all have to fill this form with your official student IDs, right? Until now, if you have any query, please ask, or shall I continue with the lecture? Do you want to ask anything? No doubts? I've already shared the link. अब आ गई? What do you mean by dengue fever? A fever which is caused because of the dengue virus. If I am suffering from the fever, but the cause of my fever is dengue virus, is known as dengue fever, that I am suffering from the fever because of the dengue virus. Clear? वॉइस का इशू है, maybe there is some technical glitch. Any other doubt students? कोई और डाउट है? Do you clear with the term dengue virus or dengue fever? Shall we continue with the lecture or do you have any other doubt students? Dengue hemorrhagic fever means that internal bleeding is also present in the patient because of the dengue virus. Now the dengue fever is become severe, right? This is the severe stage, and in the patient internal bleeding is also present. This is the meaning of dengue hemorrhagic fever. Anything else? Apart from that, it is a life-threatening form of dengue, right? And plasma leakage is also present in the body cavities, and it leads to the final stage, which is a dengue shock syndrome. Any other doubt, students? Are you not listening the lecture? We have just completed this. Dengue shock syndrome. Okay. So dengue shock syndrome, again a life-threatening complication, and it is a severe form of dengue after the dengue hemorrhagic fever, right? And it occurs when a secondary infection occurs. Okay, students. First there is a dengue fever, then there is a dengue hemorrhagic fever where bleeding is occur, where plasma start leaking inside the blood vessels, right? And it leads to the dengue shock syndrome. And in the dengue shock syndrome, there is a leakage of the leaky blood vessels are present, right? And a drop in the platelets. Platelet count will be severely dropped in case of dengue shock syndrome, and it is very severe as there are warning signs include the abdominal pain, persistent vomiting, and bleeding will be start from the patient's gums, patient's nose, right? And it can also lead to the death. Now, do you understand what is the meaning of the dengue shock syndrome and the hemorrhagic syndrome? Any other doubt, students, or shall I continue with the lecture? Okay, let's continue with our lecture. Okay, so we will discuss about the WHO classification. So it has the two classification. First one is dengue with or without the warning signs, and second one is severe dengue, right? Let's continue. So see this image. So we have the first image, dengue with or without warning signs, and the severe dengue. So first let's discuss about the with or without warning signs. So what is the criteria for the dengue when it is present with or without the warning signs according to the WHO? So this is the probable dengue. Live in or travel to the dengue endemic area, fever, and two of the following criteria will be there. It means suppose you or I am travel into the area, right, which is dengue endemic area. Now what is the meaning of the dengue endemic area, students, right? Suppose I'm going to travel somewhere, some place, and here in this particular area, the people is mostly affected with the dengue virus, right? So endemic means that a particular area of the population is severely affected with a particular type of disease. Means suppose let's take an example of Delhi. So Delhi is the area where dengue virus is mostly occur, and people is also suffering from the dengue in this particular area. So I am traveling to the Delhi, and because this area is endemic due to the dengue, so I am also suffering from the virus, right? So when I'm traveling to this area, so there is a probability, there is a high probability that I also suffering from the virus. I am also suffering from the fever because I've also catch the virus easily because this is the endemic area. And apart from having the dengue virus, I'm also showing these symptoms, right? What are the symptoms? Maybe one or two of the following symptoms surely I'm going to show. Suppose nausea or vomiting is present, or rash, there will be rashes on my body, or aches and pains, right? Tourniquet test positive, leukopenia, and any warning sign, plus laboratory confirmed dengue. So if I am going to travel in some dengue endemic area, so there are the high probability chances that I am also suffering from the dengue now, because this is the endemic area. I can easily catch the dengue virus, and these are the warning signs. So one or two of the following signs surely I am going to show, right, students? Then these are the warning signs. What are the possible warning signs in a patient who is suffering from the dengue? Abdominal pain or the tenderness, right? Abdominal pain will be there, tenderness will be there, persistent vomiting, right? Continuous vomiting after some time. Then clinical fluid accumulation, mucosal bleed. What is the meaning of mucosal bleed? So there is a layer of the skin which is known as mucosa, which is present in our gums or inside our nose. So our nose start bleeding, our gums start bleeding, right? Lethargy or restlessness, thakan hone jana, right? So patient will start feeling the restlessness. Then liver enlargement. As I've already told you, in the severe cases of the dengue virus also start affecting the liver, right? So it will cause the liver enlargement up to the 2 centimeters. More than 2 centimeters, our liver will be enlarged if I'm suffering from the dengue, right? And it is not treated on the time. Then, if I'm talking about the laboratory diagnosis, so we will observe that increase in HCP with rapid decrease in platelet count. So you will observe that there is a rapid decrease in the platelet count of the patient who is suffering from the dengue, right? So these are the warning signs which are present in the dengue. Then severe dengue. So what is severe dengue? Severe plasma leakage will be there in the body, as one of the student also asked the query, what is dengue shock syndrome or what is hemorrhagic fever, right? So as I've already told you that there is a plasma leakage also present in the body. So these are the cases of severe dengue. Both hemorrhagic fever and the shock syndrome, they both are the kind of severe type of dengue. So here severe plasma leakage will be present inside the body, right? Severe hemorrhage will be present, and severe organ impairment means our organ will be affected severely. Suppose liver will be affected severely, as it will also increases in size up to the 2 centimeters, right? So what is the criteria for severe dengue? That there will be the severe plasma leakage, and due to which shock syndrome will occur, right? Shock will occur inside the body of the patient. Then fluid accumulation with respiratory distress. Fluid accumulation will start occurring in the body cavities. Fluid will be filled, fluid will be accumulated, and due to which patient also feels breathing difficulty, right? Then severe bleeding will be there, as if evacuated by the clinician. Clinician will confirm that yes, severe bleeding will be there inside your body. Then severe organ involvement. How organ involvement? As I've already told you that liver is the organ which is involved in case of the severe dengue. So AST and
भाई हाँ? ये किसका है ये किसका है पापा हाँ? ये किसका है ये मम्मी का
viruses in our laboratory. We cannot grow our viruses on culture media plates like bacteria, right? So in the case of laboratory diagnosis of dengue virus, we have done the diagnosis with the help of antigen and antibody detection, right? So there is an antigen present in the dengue virus NS1, right? So we have to detect the NS1 antigen. So NS1 antigen detection will be there, and ELISA and ICT formats are available for detecting NS1 antigen in the serum, right? If I am suffering from the dengue virus, so the NS1 antigen of the dengue will be present inside my blood, inside my serum, right? So as a technician, you can easily first take my blood sample and then you can detect the presence or absence of NS1 antigen inside my serum sample, right? Then NS1 antigen becomes detectable from day 1 of fever and remains positive for up to 18 days, right? So when patients start suffering from the dengue virus and dengue virus enters inside the body of the patient, so from the day 1 when the fever start occurring in the patient, so from that day onwards you can easily detect the NS1 in the serum of the patient, and it remains positive up to the 18 days, right? So so accordingly you have to know in how many time you can detect some antigen or antibody. So the presence of antigen and antibody according to the days, this is very important for you. Then only you can do the test, right? If there is a patient who is suffering from the fever and it is already more than 20 days, right? 20 days is already over. So NS1 antigen will not be detected, right? So you have to be aware about the days that you can able to detect the NS1 antigen from day 1 of the fever up to the 18 days, right, students? Now antibody detection. So there are types of infection: the primary infection and the second infection and the past infection. Past infection means the infection is treated, right? The infection was present in the past, but antibodies are now also present in the body. Suppose I am suffering from the fever 2 months back, right? But against the dengue, the antibodies are present in my body, right? So this is the past infection. So in the primary infection, antibody response is slow and of low titer, right? So when primary infection occurs for the first time, so antibody response will be slow and it will be present in the low titer in our body. So first, which antibody will appear? IgM antibody will appear first in first response after 5 days of fever, right? And it will remain positive up to 90 days, as it will disappear within 90 days. So in the first exposure, first IgM will start appear inside your body to fight with the infection, right? And it will stay positive up to 90 days and disappears within the period of the 90 days, right? And it will start appear within the first 5 days of fever. Okay. Then in the secondary infection, IgG antibody titer rise rapidly, right? In the primary infection, IgM antibody titer will be there, and if in the secondary infection, when infection occurs the second time, so IgG antibody will rise in the serum of the patient. Okay. And if I'm talking about the past infection, students, so there will be the low level of IgG which is remains detectable for over 60 years, and in the absence of symptoms is a useful indicator of past infection. It means suppose I am suffering from the dengue fever, as I've already told you, suppose 3 months back or 6 months back, right? So at that time my body produce antibodies in order to fight against the infection, dengue infection, right? So at that time the IgG antibodies will start appearing and they will remain inside my body in the low titer, right? So if you are testing my blood, right, so you can easily detect the IgG antibodies inside my body, but in the low titer, because they fight against the infection 6 months back, right? So it can be detectable even over 60 years, right? And it is a useful indicator of past infection. If you are doing some research work, right, so you can easily take my sample. You can ask the patient that if you are ever suffering from the dengue fever, if say yes. If they say yes, so you can take the blood sample. You can test for the IgG antibody, and if it is present in low titer, so it is an indicator, yes, this patient is suffering from the dengue virus in the past, right? So this is the function of various antibody students. Let's move forward. So what are the antibody detection assays available with the help of which you can easily detect the antibodies or antigen in the body of the patient? So ELISA is the very common technique for the detection of antigen antibody reactions, right? It is a gold standard technique. Then we have a HAI, heme agglutination inhibition test, and then we have the CFT, complement fixation test. So these are the tests with the help of which we can easily detect the antigen antibody reactions in the patient of the body who is suffering from the dengue virus, right students? Then if you want to detect virus, again if you are doing some epidemiological study and if you are doing some research study, so in order to detect the virus, so dengue virus can be detected in blood from day 1 before the onset of symptoms up to 5 years thereafter, right? So you can easily detect the dengue virus in the blood from day 1 before the onset of the symptoms. Suppose dengue virus enter inside my body now, today, right? But my body starts showing symptoms after 2 days or after 3 days, right? But before starting the symptoms or symptoms, 1 day before the suppose my body going to start showing the symptoms tomorrow, but today also you can detect the virus inside my body, right? And you can done this up to the 5 days thereafter, right? Then virus isolation can be done by inoculation into mosquito cell line or in the mouse. As I've already told you, in order to grow the virus into the laboratory settings, you need a cell line or you need a mouse. I think you all are aware that for the experimental purposes in the laboratory, we have a mouse on which we have done our experiments, right? So if you want to done some research and if you want to study the virus and you want to cultivate the virus in the laboratory, you grow the virus, so you need either a mosquito or a mouse, right? And you can detect specific genes of the viral RNA by real-time RT-PCR polymerase chain reaction. It is a molecular level test. If you want to detect the, if you want to done the gene level detection in case of dengue, so you have to done the PCR polymerase chain reaction, right? So you have to done the molecular based testing, right, students? So this is about your dengue virus, right? So we have learned about the type of dengue virus, the classification of the dengue virus, and the laboratory diagnosis of the dengue virus, students, right? So I've already shared the link with you all. Now if you have any query, you can ask. Okay, so you want me to explain in Hindi? Okay. So you want the whole lecture in Hindi or you want some specific, आप कोई specific topic हिंदी में समझना चाहते हैं या आप चाहते हैं कि पूरा ही topic हिंदी में हो? We have time, students. अभी हमारे पास time है. अगर आप बताएंगे मुझे specify करेंगे तो हम हिंदी में अभी repeat कर सकते हैं. आप कोई specific topic चाहते हैं हिंदी में अभी आज की क्लास का या पूरा? तो मैं आपको एक क्विक ओवरव्यू दे, फिर से हम एक समराइज कर सकते हैं हिंदी में. पूरा टॉपिक आप हिंदी में समझना चाहते हैं? ओके. बच्चे मैक एलाइजा का फुल फॉर्म, द फुल फॉर्म ऑफ मैक एलाइजा इज इम्यूनोग्लोबुलिन ए antibody capture. Means antibody MAC means antibody capture, right? We have to capture the antibody because ELISA is the test for antigen antibody reaction, right? And the full form of ELISA is enzyme linked immunosorbent assay. So this is the full form of ELISA. Okay, so we will summarize our topic in Hindi. Okay, listen carefully. So we will discuss our topic once again in Hindi. Just give, मैं एक बार अपना स्क्रीन शेयर कर लेती हूँ. Just give me a minute. तो बच्चों आज हमने डेंगू वायरस के बारे में पढ़ा, ठीक है? तो डेंगू वायरस एक बहुत ही ज्यादा कॉमन वायरस है जो इंडिया में पाया जाता है, ठीक है? एर्बो वायरस का क्या मतलब है? एर्बो डेंगू वायरस एक क्लासिफिकेशन है, मेन क्लासिफिकेशन है जिसके अंडर डेंगू वायरस आता है, ठीक है। तो इसके 4 सीरोटाइप होते हैं डेंगू वायरस के, डेंगू वायरस 1, 2, 3, 4, राइट। और 2013 में 2013 में बैंकॉक से एक 5th सीरोटाइप भी डिस्कवर किया गया था विच इज नोन एज DEN5। तो अब डेंगू वायरस के 5 सीरोटाइप है, डेंगू वायरस 1, 2, 3, 4, 5, राइट। आगे बढ़ते हैं। वेक्टर, वेक्टर का क्या मतलब होता है, जिसकी वजह से इन्फेक्शन एक इंसान से दूसरे इंसान तक पहुंचेगा, या जैसे कि यहाँ पे वेक्टर है मॉस्किटो, मच्छर, तो मच्छर से इंसान तक पहुंचेगा। सपोज मुझे कोई पैरासाइट का इन्फेक्शन हुआ है, तो वो मेरी बॉडी तक पहुंचेगा कैसे, ट्रांसमिट कैसे होगा। तो वेक्टर एक रूट ऑफ ट्रांसमिशन है। अगर मैं गंदे हाथों से खाना खा लूं या कंटेमिनेटेड खाना खा लूं, तो मेरे बॉडी में वो पैरासाइट चला जाएगा। ऐसे ही यहाँ पे जो हम डेंगू वायरस के बारे में बात कर रहे हैं, तो इन्फेक्शन को ट्रांसमिट करने के लिए, एक जगह से दूसरी जगह पहुंचाने के लिए कुछ तो चाहिए, एक रूट ऑफ ट्रांसमिशन तो चाहिए। तो यहाँ पे रूट ऑफ ट्रांसमिशन वेक्टर है, राइट। अब वेक्टर कौन सा है, 2 मॉस्किटो, मॉस्किटो पता है आप लोगों को, मच्छर। तो कौन से मॉस्किटो, पहला है एडिस एजिप्टी और दूसरा है एडिस एल्बोपिक्टस, राइट। तो ये दोनों मॉस्किटो है जो वेक्टर का काम करते हैं, जो डेंगू वायरस को फैलाते हैं एक जगह से दूसरी जगह, ठीक है। अगर मुझे डेंगू वायरस है और ये मच्छर मुझे काट लेता है और फिर ये सेम मच्छर किसी और को काट लेगा, तो उसको भी डेंगू हो जाएगा, राइट। और मच्छर में ऑलरेडी डेंगू वायरस प्रेजेंट है, तो वो इजिली अब किसी और इंसान को वायरस ट्रांसमिट कर सकता है। तो ये होता है वेक्टर। अब अगर ट्रांसमिशन साइकिल की बात करें, तो इस डेंगू वायरस के केस में जब ट्रांसमिशन होता है, तो सिर्फ मैन यानी कि ह्यूमन बींग्स और एडीज यानी कि मॉस्किटो, सिर्फ ये 2 लोग प्रेजेंट होते हैं। इनके अलावा कोई और एनिमल प्रेजेंट नहीं होता है, राइट। डज नॉट इन्वॉल्व एनी अदर एनिमल। तो अगर ट्रांसमिशन साइकिल की बात करें, तो डेंगू वायरस के केस में सिर्फ 2 ट्रांसमिशन के लिए 2 लोग प्रेजेंट होते हैं, एक तो मैन, ह्यूमन बींग्स एंड द मॉस्किटो, राइट। फिर हमने पढ़ा था क्लासिफिकेशन। तो डेंगू वायरस की 3 क्लासिफिकेशन होती है, डेंगू फीवर, डेंगू हेमोरेजिक फीवर और डेंगू शॉक सिंड्रोम, ठीक है। तो डेंगू फीवर में क्या क्या होगा, अचानक से हाई फीवर होगा, पेशेंट को फीवर चढ़ेगा, फीवर उतरेगा, जिसको हम बाइफेजिक फीवर या सैडल ब्लैक फीवर भी कहते हैं, जिसमें आगे की साइड फ्रंटल हेडेक होगा, मसल्स में जॉइंट्स में पेन होगा, आंखों में दर्द होगा, ये सारी कैरेक्टरिस्टिक्स है, राइट। हेमोरेजिक फीवर की बात करें, तो हेमोरेजिक फीवर और डेंगू शॉक सिंड्रोम, ये दोनों सीवियर फॉर्म है डेंगू की। तो इसमें क्या होगा, इंटरनल ब्लीडिंग होगी, प्लाज्मा लीकेज होगा, ठीक है, ब्रीदिंग डिफिकल्टी होगी एंड इवन पेशेंट की डेथ भी हो सकती है। और ऑर्गन का भी इन्वॉल्वमेंट होगा, यानी कि लिवर एक सबसे कॉमन ऑर्गन है जो डेंगू की केस में अफेक्ट करता है पेशेंट को, राइट। तो लिवर सबसे पहले अफेक्ट होता है अगर डेंगू सीवियर हो जाए, और वो लिवर को खराब करना स्टार्ट कर देता है। तो ये दोनों सीवियर फॉर्म है डेंगू की, डेंगू हेमोरेजिक फीवर एंड डेंगू शॉक सिंड्रोम, राइट। डेंगू शॉक सिंड्रोम में पेशेंट की जो स्किन है वो ठंडी पड़ने लग जाती है, उसको जल्दी थकान होने लगती है, पल्स रेट गिरने लगता है, ये सारे सिम्टम्स हैं। उसके बाद हमने देखा है कि WHO ने 2009 में एक क्लासिफिकेशन दिया था 2009 में, कि डेंगू को उन्होंने 2 तरीके से क्लासिफाई किया था। एक उसके सीवियरिटी के बेसिस पे कि कितना सीवियर है। तो एक क्लासिफिकेशन था डेंगू जिसमें सिम्टम्स दिखेंगे या नहीं दिखेंगे, जो कि कम सीवियर है। दूसरा था सीवियर डेंगू, राइट। तो अब हम इसको डिस्कस कर लेते हैं। तो ये दोनों क्लासिफिकेशन है, पहला है डेंगू विद और विदाउट साइंस, यानी कि इसमें सिम्टम्स दिखेंगे या नहीं दिखेंगे, और दूसरा है सीवियर डेंगू। तो ये हमको कैसे हो सकता है, सपोज मैं किसी जगह गई, मैंने ट्रैवल किया और वो जगह डेंगू एंडेमिक है। डेंगू एंडेमिक मीन्स कि एक पर्टिकुलर जगह है जहाँ पे डेंगू वायरस सबसे ज्यादा होता है, सबसे ज्यादा डेंगू फीवर यहाँ पे लोगों को होता है। एंडेमिक का मतलब ये है कि एक पर्टिकुलर जगह पे पर्टिकुलर डिसीज सबसे ज्यादा होता है। तो मैं ऐसी जगह पे गई जहाँ पे डेंगू, जो जगह एक डेंगू एंडेमिक है, राइट। तो बहुत ही ज्यादा प्रोबेबिलिटी है कि मुझे भी डेंगू हो जाए, राइट। और उस केस में क्योंकि मुझे डेंगू अभी स्टार्ट हुआ है, तो या तो मुझे सिम्टम शो होंगे कि नहीं होंगे, राइट। तो क्या क्या सिम्टम्स हो सकते हैं, या तो मुझे नोजिया और वॉमिटिंग हो सकता है, या मेरी बॉडी पे रैशेस हो सकते हैं, या कहीं पे पेन हो सकता है, राइट। वार्निंग साइंस क्या क्या होते हैं डेंगू वायरस के, जो कि आपको वार्न करते हैं कि हाँ कोई प्रॉब्लम है एंड ट्रीटमेंट जरूरी है, टेस्टिंग जरूरी है, और वार्न करते हैं कि हाँ डेंगू हो सकता है। एब्डोमिनल पेन यानी कि पेट में दर्द होना, परसिस्टेंट वॉमिटिंग, बार बार वॉमिटिंग होना, राइट। फ्लूइड एक्यूमुलेशन यानी कि फ्लूइड फिल हो जाता है कैविटीज में, जिसकी वजह से ब्रीदिंग डिफिकल्टी भी होती है। म्यूकोसा ब्लीडिंग यानी कि म्यूकस लेयर होती है जो हमारे गम्स में प्रेजेंट होती है, दांतों के ऊपर, मसूड़ों में, या हमारी नाक के अंदर, आंखों के अंदर, ठीक है। तो म्यूकस लेयर में हमारे ब्लीडिंग स्टार्ट हो जाती है, आंखों में दर्द होने लगता है। तो ये कुछ वार्निंग साइंस है। और जैसा कि मैंने आपको बताया, लिवर सबसे ज्यादा अफेक्ट होता है, तो लिवर का साइज बढ़ने लगता है, 2 सेंटीमीटर तक लिवर का साइज बढ़ने लगता है, तो ये वार्निंग साइंस है। वही प्लेटलेट काउंट भी गिरने लगेगा। वहीं पे अगर मैं सीवियर डेंगू की बात करूं तो प्लाज्मा लीकेज होगा, ऑर्गन खराब होंगे, राइट। सिंड्रोम, शॉक में चला जाएगा पेशेंट, ब्लीडिंग होगी, लिवर में जो एएसटी और एएलटी की वैल्यूज है वो 1000 से ऊपर बढ़ने लगेंगी, राइट। और लिवर खराब होने के बाद अगर वो और सीवियर होता है डेंगू और ट्रीटमेंट टाइम पर नहीं मिलता है तो और ऑर्गन्स भी अफेक्ट होना स्टार्ट हो जाएंगे, जिसमें कि हमारा सेंट्रल नर्वस सिस्टम भी अफेक्ट होगा, हार्ट भी अफेक्ट होगा, और बाकी ऑर्गन्स भी अफेक्ट होंगे, राइट। उसके बाद हमने लैब डायग्नोसिस की बात की थी। तो लैब डायग्नोसिस, क्योंकि ये वायरस है, इसको हम बैक्टीरिया की तरह अपनी लैब में कल्टीवेट नहीं कर सकते, हम कल्चर मीडिया प्लेट पे इसको ग्रो नहीं कर सकते। किसी वायरस को ग्रो करने के लिए हमको सेल लाइन्स की जरूरत है, या तो हमें किसी माउस की जरूरत है, या हमें मॉस्किटो सेल लाइन्स की जरूरत है। जब भी हम कोई रिसर्च करते हैं तो हम माउस पे करते हैं, राइट। तो अगर हमको फिर भी अपना वायरस को ग्रो करना है तो उसके लिए हमको या तो मॉस्किटो की सेल लाइन्स चाहिए या माउस चाहिए, राइट। तो इसलिए जब लैबोरेटरी डायग्नोसिस की बात आती है डेंगू के केस में, तो हम यहाँ पे एंटीजन और एंटीबॉडी डिटेक्ट करते हैं। तो NS1 एंटीजन प्रेजेंट होता है डेंगू में, जिसे हम डिटेक्ट कर सकते हैं इजीली एलाइजा की हेल्प से। एलाइजा गोल्ड स्टैंडर्ड टेस्ट है, सबसे कॉमन टेस्ट है अगर हमें कभी भी एंटीजन एंटीबॉडी टेस्ट करना है तो, ठीक है। और NS1 एंटीजन जो है वो आपके फीवर के एक दिन पहले से आप उसको डिटेक्ट कर सकते हो और 18 दिन तक वो पॉजिटिव रहता है, ठीक है। वहीं पे अगर हम एंटीबॉडी की बात करें तो 3 टाइप के इन्फेक्शन है, प्राइमरी, सेकेंडरी और पास्ट इन्फेक्शन, ठीक है। पास्ट इन्फेक्शन का मतलब कि मुझे 6 महीने पहले इन्फेक्शन हुआ था, लेकिन अभी भी मेरी बॉडी के अंदर एंटीबॉडीज होगी जो उस वक्त बनी थी इन्फेक्शन से फाइट करने के लिए, राइट। अगर मैं प्राइमरी इन्फेक्शन की बात करूं तो सबसे पहले जो एंटीबॉडी बनती है किसी भी इन्फेक्शन के अगेंस्ट वो है IgM एंटीबॉडीज, राइट, जो 5 दिन के अंदर अंदर बन जाएगी फीवर के, और 90 दिनों के अंदर अंदर डिसअपियर हो जाएगी, गायब हो जाएगी। अगर सेकेंडरी इन्फेक्शन की बात करूं तो IgG एंटीबॉडी को आप डिटेक्ट कर सकते हैं। और अगर पास्ट इन्फेक्शन की बात करूं, इट कैन बी डिटेक्टेबल ओवर 60 इयर्स, मतलब सपोज मुझे 2 साल की 60 सालों तक आपकी बॉडी में प्रेजेंट रहता है। सपोज किसी पेशेंट को डेंगू हुआ है 2 साल पहले, 1 साल पहले, 6 महीना पहले, लेकिन वो ठीक हो चुका है, तो फिर भी उसकी बॉडी के अंदर IgG एंटीबॉडीज प्रेजेंट रहेंगी, और ये एक इंडिकेटर है पास्ट इन्फेक्शन का, राइट। सपोज आप कोई रिसर्च कर रहे हैं, आपने मुझसे पूछा कि क्या आपको कभी पहले पास्ट में डेंगू इन्फेक्शन हुआ है, मैं कहूंगी हाँ मुझे हुआ है। तो आप जब मेरे सीरम को टेस्ट करेंगे तो आपको उसमें IgG एंटीबॉडीज मिलेंगी, अगर मुझे डेंगू हुआ है कुछ समय पहले, या 2 साल पहले, या 3 साल पहले, ठीक है। लेकिन वो लो टाइटर में प्रेजेंट होगी तो आप कह सकते हैं यस दिस पेशेंट, इस पेशेंट को पहले डेंगू फीवर हुआ है, क्योंकि IgG एंटीबॉडीज प्रेजेंट है लो टाइटर में, ठीक है। फिर ये कुछ एसेस है, ये कुछ टेस्ट है जिसकी हेल्प से आप एंटीजन एंटीबॉडी डिटेक्ट कर सकते हैं, जैसे कि एलाइजा, हीम एग्लूटिनेशन टेस्ट, कॉम्प्लीमेंट फिक्सेशन टेस्ट। और वायरस डिटेक्शन मैंने आपको बताया, स्टूडेंट वायरस डिटेक्शन के लिए आप PCR भी कर सकते हैं, और उसके लिए आपको ह्यूमन या मॉस्किटो सेल लाइन्स चाहिए, राइट। तो कोई और अगर डाउट है आपको, आई होप अब आपको क्लियर होगा, राइट। हाँ, वेक्टर एक वेक्टर डिसीज नहीं है, वेक्टर एक, सपोज आप कह सकते हैं एक इंसेक्ट या कोई जानवर जो वेक्टर की तरह काम करता है। मुझे डेंगू है तो वो मच्छर मुझे काट लेगा, अब उसमें भी डेंगू वायरस आ गया, अब वो किसी और पेशेंट को काट लेगा तो उसको भी डेंगू वायरस हो जाएगा। तो वेक्टर का काम कर रहा है, मतलब एक जगह से दूसरी जगह फैला रहा है, ठीक है। तो अब क्लियर है आप लोगों को? एनीथिंग एल्स? ओके ओके, थैंक यू सो मच। मैंने फिर से